I first knew I wanted to be a physician pretty early on in childhood. I think one of the things I remember the most is going to the doctors every time I didn't feel well, whether it's a cold or a rash, and then I would always walk out feeling better. And so it's that property that you could heal somebody that really drew me to this field. I really enjoy women's medicine because the number one is I am a woman myself, and I really like to learn things that apply to myself, and I really like to pass on that knowledge to other people. I would say the most challenging aspect of this career as an OBGYN is delivering bad news. And I think most people think of OBGYNs as a very happy career where you deliver babies, deliver happy news. But unfortunately, there are certain cases where the optimal outcome isn't there. And sometimes you just have to tell a patient you're sorry or that there's not much you can do. And to me, I think that's very challenging. One of the most memorable patient encounters that I've had was a patient that came to me initially for abnormal pap smears. And she's older. She's had it for more than 10 years. She's seen multiple doctors, and she came to me after moving to the area. And it started off as a very untrusting relationship because she's seen so many doctors and they all kind of did nothing for her. And so she just didn't have a lot of trust. And when she first saw me, she wanted major surgery. She wanted to have her uterus out. And after reviewing her records and her charts, I recommended a different form of treatment for her, conization. And once again, she definitely was not very trusting of that route of action. But after kind of addressing her fears, trying to understand where she's coming from, we both agreed to proceed with the cone. Everything was benign. Everything went well. I continued to see her for probably 2.5, 3 years for pap smears. They've always been normal, and I would say that every visit after that conization, she had a change in the way she interacted with me. She was very trusting. I think it's that trust building with patient, especially this one, that was very memorable for me. When I meet someone new, I try to get to know them, not as a patient, but just as another person. Trying to find where they're coming from, trying to understand their culture, because culture is a very big part in how someone reacts to diagnosis, certain treatments, and how they respond to you. 3 words that I use to describe myself is meticulous, creative, and multitasker. I keep current on my medical knowledge by a couple different ways. One, I talk to my colleagues because one mind is better than, or multiple minds is better than one. I also read up on journals. There's a Green OBGYN journals that gets released monthly with all the updated information. And I read on websites. So I love to cook and bake. I don't like to clean, so I will do the former and not the latter. I also like to garden. That's a new hobby of mine. I think it's in the genes. So it's kind of a new thing that me and my dad have started to do together is to garden. I love planting fruit trees. I love picking fruit. And I like to karaoke. I like women's medicine because it applies to me. I am a woman and I love learning about my own body, to my mom and my aunt's bodies, and it's interesting to read up on those and to actually share that information with other people. And it's exciting and motivating at the same time. There is a lot in a woman's body that changes through the years from, being a child to puberty, adolescence, and then to menopause. As a general OBGYN, we are pretty adept at taking care of the whole wide range, but I think my particular love is the reproductive age. I think it's amazing to take care of a woman while they're pregnant and to see that outcome. I think what makes Orange Coast Women's Medical Group different than other groups out there is that we are a large group that is very diverse. And so there is a doctor out there for any patient that you can think of. And the patients have a choice. They have a choice to find someone that they mesh well with. And from a doctor's standpoint, we have colleagues that are easily accessible. I get to talk to other peers about treatments, new treatments, diagnosis. So we are a very cohesive group. We put our patients' best interest at heart. And I just think that it's the diversity that is what drives us to be different.